Welcome to this two-part presentation on sensory impairments commonly seen in the classroom with Annika Teskey, Aidan Ladd, and Fletcher Holtz.
There are three types of sensory impairments seen in today's classroom. The first is visual impairments such as legal or complete blindness. The second is auditory impairments such as being deaf or hard of hearing. Then there are other impairments such as epilepsy, ASD, and cerebral palsy.
A visual impairment is defined as the limitation of actions and functions of the visual system. The National Eye Institute defines low vision as a visual impairment not correctable by standard glasses, contact lenses, medication, or surgery that interferes with the ability to perform activities of daily living.
A hearing impairment is a hearing loss that prevents a person from totally receiving sounds through the ear. If the loss is mild, the person has difficulty hearing faint or distant speech. A person with this degree of hearing impairment may use a hearing aid to amplify sounds. If the hearing loss is severe, the person may not be able to distinguish any sounds. There are four types of hearing loss. The first is conductive, caused by diseases or obstructions in the outer or middle ear that usually affect all frequencies of hearing. A hearing aid generally helps a person with a conductive hearing loss. Second is sensory neural, results from damage to the inner ear. This loss can range from mild to profound and often affects certain frequencies more than others. Sounds are often distorted even with a hearing aid. The third is mixed, which is a combination of the first two types of hearing loss. Then the fourth, which is central, results from damage to the central nervous system.
Epilepsy is a neurological disorder that causes recurrent seizures and episodes of sensory disturbances. Outside factors such as flashing lights or loud noises may trigger seizures in people with epilepsy. These seizures occur when there are abnormal levels of glucose and sodium present in the brain. Palsy happens when brain damage occurs before or during infancy that causes a child to have problems with coordinating his or her body movements. The most common form of cerebral palsy is characterized by spasticity, which means the child has overly tight or tense muscles.
ASD or autism spectrum disorders are characterized by social interaction difficulties, communication challenges, and a tendency to engage in repetitive behaviors.